Welcome back to Cancer Buzz. I'm your host, Summer Johnson. The need continues to grow for underserved populations to be able to access guideline-concordant biomarker testing. So care teams need to stay up to date with policy changes for Medicaid beneficiaries. Today we discuss the legislative outlook for 2024 and some of the challenges of implementing model legislation. Hilary Gee Goeckner is the Director of State and Local Campaigns for Access to Care at the American Cancer Society Cancer Action Network, or ACS CAN, in Covington, Louisiana.
ACS CAN worked with ACCC and a number of other partners representing patient groups, provider associations, and others to develop model legislation to align coverage of biomarker testing with the latest evidence. And so this looks at all state-regulated health insurance plans, including Medicaid, and requires coverage of comprehensive biomarker testing to guide and inform treatment when it's supported by the latest evidence.
Can you share some of the updates on state legislation?
Sure. So at the end of 2023, we've had 14 states enact some version of this model legislation. New York's bill was signed by Governor Hochul just before Christmas. So that brought the total to 14 states with this legislation in place. And in 2024, we've got a lot of legislative activity across the country, about 12, 13 states with bills introduced and moving at various points in the legislative process.
What does it mean to introduce that legislation to states?
We've been working to soften the ground and prepare for good legislative opportunities. So, before getting a bill introduced or finding a bill sponsor, we're working on building a coalition of patient and provider groups and advocates, identifying compelling patient stories of people who've benefited from biomarker testing and can explain what it meant for them and their treatment for cancer or another condition, and beginning to educate lawmakers so they have an idea what the heck we're talking about before we even get to the point of introducing bills and trying to get something through the legislative process.
What are some of the implementation challenges for states who have already enacted the legislation?
There's often 6, 8, sometimes as much as 18 months between when the legislation passes and when it actually applies to new insurance policies. But then, the goal is certainly for more patients to be able to get the testing that they need. And so there are a lot of challenges around implementation. Getting the legislation passed is just the first step. So ideally, insurers are updating their policies, but it's also important for providers to be aware of the new rules that affect many plans in their states. So they're able to actually order testing that might have been not covered or rejected previously for similar plans, and that industry groups, so providers and testing companies and others, are working together to hold insurers accountable for covering the testing that patients need.
What about community cancer programs in rural areas or underserved areas? What are they facing?
Sure. So one of the big disparities that we see in access to biomarker testing is based on kind of the location where someone lives or where they're receiving treatment. There are a number of really unacceptable disparities in access to biomarker testing and who is benefiting from the most effective care for cancer or another condition. And we see that both in the location of treatment as well as the type of insurance that people have. So patients who are covered by Medicaid are less likely to get guideline-indicated biomarker testing, and coverage is a piece of the puzzle that is really important to bridging those disparities.
Thank you, Hilary. It's always a pleasure to speak with you. Take a look at the show notes for more resources on 2024's legislative outlook for biomarker testing. This episode is made possible with support by Foundation Medicine and Exact Sciences. Finally today, if you're listening to the show on Apple Podcasts, the platform paused all its shows for regular listeners recently as part of an update. You can fix this by going to the Cancer Buzz channel on the app right now. And in the top right corner, if you see a pause sign, hit that. Or hit the plus sign or downward arrow to make sure you're following the show and you'll get the latest releases when they drop. Until next time, for the Cancer Buzz crew, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.